How were surgeries performed before the discovery of anesthesia, when pain was part of the treatment? Surgery was not what we know today. There was no general anesthesia, no machines to monitor the heartbeat, and no doctor reassuring the patient that they would feel nothing. Instead, pain was part of the operation itself, and the surgeon had to complete the procedure as quickly as possible. Not simply because he feared that the operation might fail, but because he knew that every extra second meant unbearable pain. For centuries, the question was not, can the doctor perform the operation? The real question was, can the patient survive it? And yet, human beings managed to perform complex surgeries. They amputated limbs, removed kidney stones, treated broken bones, and even performed operations on the skull. All of this long before the discovery of anesthesia. So how did they do it? What did they use to relieve the pain? And when did surgery transform from a terrifying experience where the patient could suffer immensely into one of the greatest achievements of modern medicine? In this episode, we will travel back through history to discover how the discovery of anesthesia changed medicine forever. Many people believe that surgery did not begin until after the discovery of anesthesia. But the truth is, humans have been performing surgical procedures for thousands of years. Archaeological evidence suggests that people practiced various forms of surgery as far back as prehistoric times. Archaeologists have discovered skulls with carefully made holes whose edges had healed after the procedure. This indicates that the people who underwent these operations survived for some time after the surgery. This procedure is known today as trepanation, and scientists are still debating the exact reason why it was performed. It may have been used to treat head injuries, or to relieve pressure inside the skull, or perhaps for religious or ritual purposes. In some societies, as the centuries passed, surgery continued to develop within ancient civilizations. In ancient Egypt, physicians described methods for treating fractures, suturing wounds, and stabilizing injured limbs. In Mesopotamia, medical texts recorded various medical procedures, including the treatment of serious injuries and wounds. Then came the Greeks and the Romans. Surgery became more organized, especially on the battlefields. Doctors were forced to remove arrows, extract spears, and amputate limbs that could no longer be saved. But, despite all this progress, there was still one enemy that everyone feared. Not infection, not bleeding, but pain. In those days, there was no medicine capable of making the patient lose the sensation of pain. The patient had to remain awake throughout the operation. They could see, hear, and feel everything. And because of this, a surgeon's skill was not measured only by the precision of their hands. It was also measured by their speed, because every second meant more pain, and sometimes it meant the difference between life and death. Faced with such overwhelming pain, humans began searching for anything that might reduce the patient's suffering. And here begins the next stage of our journey. Doctors did not simply accept that patients should suffer without trying to help. For thousands of years, humans began searching for any substance that might relieve pain, and for any method that might make surgery less unbearable. In ancient civilizations, doctors relied on plants that they had observed could affect consciousness or the sensation of pain. In Mesopotamia and ancient Egypt, the poppy plant was known as a source of opium. They did not know how it actually worked, but they noticed that it could relieve pain and cause drowsiness. Alcoholic drinks were also used in an attempt to reduce the suffering of patients. And although alcohol could reduce anxiety or cause some dizziness, it did not prevent pain during surgery. As medicine advanced in ancient Greece and later in Rome, new preparations based on other plants began to appear, such as mandrake, also known as mandrake, hemlock, and other plants containing compounds that could affect the nervous system. But there was a major problem: the correct doses were not known. The amount could be too small and provide little or no benefit. Or it could be too large, causing poisoning that could cost the patient their life. During the Middle Ages, and later, during the Golden Age of Islamic civilization, physicians continued to develop these methods. Scholars such as Abu al-Qasim al-Zahrawi and Avicenna described medicines and pain-relieving preparations that could be used to reduce pain before certain procedures. There were also accounts of a method known as the soporific sponge. The sponge was soaked in different plant extracts and then brought close to the patient's nose so they could inhale the vapors in an attempt to reduce consciousness and ease the pain. But all of these methods varied from one patient to another, and none of them was capable of producing complete anesthesia as we know it today. And because of this, pain continued to accompany every surgical operation. The surgeon had to face not only the disease, but also time. Because every minute the patient spent on the operating table meant more pain and greater danger. And in those days, a surgeon's speed was not simply a skill. It was a means of potentially saving a human life. Even with the use of opium, alcohol, and pain-relieving plants, most patients remained conscious during surgery. And the pain was still there. That is why speed became one of the most important skills a surgeon could have. During the 18th century and the beginning of the 19th century, surgeons trained to complete operations in the shortest time possible. It was not a display of skill. It was an attempt to reduce the patient's suffering, because every extra minute meant more intense pain, more bleeding, and a greater risk of losing consciousness or dying. Amputations were among the most common operations of that era, especially on battlefields. When limbs suffered severe fractures or were shattered by bullets or cannon fire, the surgeon often had only one option: amputation. The patient was held firmly so they would not move during the operation. Sometimes several people had to hold the patient's arms and legs so the surgeon could work. Then the surgeon would cut through the skin, then the muscles, and finally the bone using a surgical saw. After the amputation, the bleeding had to be stopped, either by tying off the blood vessels or, in earlier times, by using cauterization with fire. Those moments were among the most painful a human being could endure. But, despite their cruelty, these operations saved many lives. In certain cases, amputating a limb was better than allowing an infection or injury to spread throughout the body. As time passed, surgical instruments became more advanced. But the greatest problem had not changed. Pain still dominated the operating room. And doctors began to realize that the future of surgery would not truly change until they found a way to take away the patient's sensation of pain. What the world did not know was that that moment was now very close. And for thousands of years, things remained this way. Surgery meant pain, and pain was an unavoidable part of the experience. Until the 19th century arrived. During this period, scientists began to understand chemistry much better. They started studying the effects of certain gases and liquids on the human body. Among these substances was a colorless liquid with a distinctive smell. It was known as ether. At first, it was not used in medicine. Instead, it was known as a chemical substance that could cause dizziness and loss of consciousness when inhaled. But no one imagined that it could change the history of surgery. On the 16th of October, 1846, a group of doctors gathered at Massachusetts General Hospital in Boston, in the United States. Many of them were skeptical about the idea. Could a surgical operation really be performed without the patient feeling pain? A dentist, William Thomas Green Morton, stepped forward with a simple device containing ether vapor. He asked the patient to inhale the vapor for a few minutes. And after the patient lost consciousness, the surgeon, John Collins Warren, began removing a tumor from the patient's neck. The operation ended, and the patient regained consciousness. When he was asked about the pain, he said he had felt very little. Silence filled the operating room. Then everyone realized that they had just witnessed a moment that would change medicine forever. It was not long before ether anesthesia began to spread through hospitals around the world. For the first time, the surgeon was no longer forced to race against pain. Operations that had once seemed impossible or extremely dangerous became safer and more precise. But ether was not the end. It was the beginning of a new era. The discovery of ether was not merely a way to prevent pain. It was the beginning of a medical revolution that changed the future of surgery. Just a few years later, doctors began using other substances that were more effective. One of the most famous was chloroform. In 1853, chloroform gained widespread recognition after the British physician John Snow used it to relieve the pain of childbirth for Queen Victoria. From that moment, the use of anesthesia became more widely accepted in Europe and later throughout the rest of the world. As medicine continued to advance, anesthesia was no longer based on a single substance. It became a medical specialty with its own physicians, equipment, and research. Today, before any surgical operation begins, an anesthesiologist evaluates the patient's condition and chooses the most appropriate type of anesthesia. It may be general anesthesia, where the patient loses consciousness completely, or local anesthesia, which prevents the sensation of pain in a specific area. or regional anesthesia, which is used for certain procedures without requiring the patient to lose consciousness. During the operation, advanced monitors continuously track the patient's heart rate, blood pressure, oxygen levels, and breathing rate moment by moment. And the anesthesiologist is responsible not only for preventing pain but also for maintaining the stability of the body's vital functions throughout the operation. Thanks to these advances, procedures that were once considered impossible are now performed routinely, including open heart surgery, organ transplantation, brain surgery, and operations that can last 10 hours or even longer. None of this would have been possible without the discovery of anesthesia. For centuries, pain was the greatest enemy of surgery. But science did not simply conquer pain. It opened the door to a new era in which saving human lives became safer than ever before.